listening to Inside CDDFT, the podcast for the County Durham and Darlington NHS Foundation Trust.
Hello and welcome to Inside CDDFT. We're back with another podcast episode. Thank you so much for joining us. I'm Rachael Stray from the communications team here at the Trust, and I'm joined today by two very special guests. So this is a special episode where we are focused on Spiritual Care Week. So I'm joined by two guests who will just introduce themselves now.
Hi everyone, my name is Alex O'Brien. I am part of the CDFT Workforce Experience team.
I'm Catherine Miner, and today I represent the Chaplaincy team in the Trust.
Brilliant. Thank you so much, both of you, for giving up your time today. It's currently a very warm day outside, so we're very grateful to be in a nice air-conditioned studio today, making the most of the last of the summer days. Catherine is a fantastic member of our wonderful chaplaincy team. We are incredibly lucky to have such a wonderful team that has grown over the last few years, and she's recently celebrated a very special milestone, 25 years of service, which is just absolutely fantastic. And we'll be getting into a bit more about what her role is in the chaplaincy team, what it's like, as we delve into this episode. So I'm going to hand over to you, Alex, first.
Thanks, Rachel. Catherine, I suppose, first of all, congratulations, 25 years, what a milestone. It's fantastic. Obviously, you've got a vast range of experience over those 25 years, and hopefully we'll spend the next couple of minutes tapping into some of that and get some examples. So I'm going to start off with just asking you how you describe your role as a healthcare chaplain.
Thank you, Alex. Thank you, Rachel. Well, I'd like to begin by saying that the role is really a joy and a privilege, sometimes also very costly, naturally, as it involves working with people. I think part of the heart of it is that people invite us into key moments in their lives, which may be either very happy or indeed very sad. But this is a huge sense of privilege we have when people invite us in. As you've acknowledged, I'm a Christian, I'm a baptised Christian, a Methodist minister, and I guess this is the main lens through which I see the world. So I see our work very much as being a ministry of spiritual accompaniment, when we're looking at going beyond the material to try and discern what's going on in the depths. Because naturally symptoms that sometimes present have underlying causes. So if we can work with people to tease out underlying things, this may sometimes facilitate a quicker recovery for them. It's also important that we're not frightened of being in places of unknowing. On a daily basis we can be confronted with things that certainly I don't always understand how or why things happen as they do, and it's important to not be afraid to acknowledge that. So in essence, I think we're talking about a practice of being attentive, of cultivating deep listening, and also about being fully present to the other person.
Fantastic. I think that's a really fair summary of the fantastic work that you all do as a wonderful team. So, Catherine, what kinds of situations or patient needs would you say you most commonly encounter?
Yes, thank you, Rachel. Well, again, one of the delights of chaplaincy is that everybody has bespoke needs, and we are given the autonomy to assess situations in a very bespoke and individual way with people. So a lot of our interactions tend to be ones-off. So sadly we would encounter people who are dying. We may see that person just the once. We may encounter the family just the once, and it's unlikely we'll see them again. Mind you, at the same time we find ourselves working alongside people who are perhaps living with chronic conditions, maybe like Parkinson's, and over time the gaps between their admissions become smaller and smaller. So we may find that we're journeying with some people over the course of years. I think a lot of what we do is we want to normalise things and to pay attention to what people are telling us. And so by normalising, I mean accepting, yes, a person's in pain, so they might be angry, they might be frightened. It may be normalising the fact that a person is about to die. They've arrived at this point with their family with them, hopefully, and that might be frightening. It may be about assessing what can be sometimes very complex family dynamics along with colleagues, particularly working in ITU, for example. And And the fixed points are that the Trust asks us to engage with people who are actively recognised as dying. And sadly, some days that can take up most of our time.
I can imagine.
So, Catherine, what skills or qualities do you think are essential to make an effective trust chaplain?
I think being able to listen fully, as I've said, is a very important skill. Being prepared to remain with people who may be angry or frightened, very important. I think it's also very important for us to suspend our own judgments about things. I can remember a while ago I was going to encounter my first ever bariatric patient. So as I walked towards the ward, I was chuntering to myself, walk around more, eat less. And then my kind of better self kicked in. And when I listened to the person, early on in the conversation, they said to me, "Oh, love, if only I knew then what I know now, I would have done things very differently." And I think who of us couldn't say that?
Absolutely.
So the bedside is not a place for judgments. And also, it's important, I think, in life and in ministry, to learn not to take things personally.
I wish I could do more of that. I think the taking things personally aspect.
Yeah, it's a good practice, Rachel. Yeah, easy to say. Yeah.
So this one might be a bit of a difficult one for you, because I know that every day is different. The job is very varied. The role is very varied. But if you could try, for those who maybe have never encountered a chaplain, if you could try and talk us through, what does a typical day look like for you as a chaplain?
Well, as I said, we're all very different as people in our team, which is great. My friends and colleagues laugh at me sometimes as a Methodist, because I do tend to kind of quite like order and structure. So one of the fixed points in my day is I like to come in and I like to, on a daily basis, update the EPR so that we can know where we're starting from. And as I said earlier, 3 times a day the Trust asks us to look at the EPR to find out who's dying. Now, the bread and butter of our work is, of course, the ward visiting. And so we might go onto a ward and talk not only with patients, but also with staff, which is something maybe we will address a bit later. As I said earlier, I'm one of the religious chaplains. So part of my ward visiting, if the patient is religious, might be to offer sacramental support to the patient in the form of Holy Communion or prayer, which may be very important to people. If a person's Roman Catholic, once they realise they're dying, it may be very important to them to have a priest visit them. So this is all about providing for people's widest needs. Increasingly, and I would say since the pandemic, we do have greater engagement with staff. And it's certainly becoming apparent to me in the last few months how many of our colleagues obviously are in a caring role at work and then go home and maybe assume a second role of caring, perhaps for an aged parent or indeed grandchildren. So ward visiting on a daily basis is very, very important, not only for patients but also for staff who wish to engage and to offer that kind of informal debrief. So we might then stop by the library. Want to big up the library in the podcast. Great colleagues recently found me 2 articles from 2 journals I'd never heard of before about the sociology of religion. So great service there, keeping our learning up to date. We might find ourselves liaising with the Trust Bereavement Support Officer. We might be working together closely on a public health funeral, which the Trust offers in very specific circumstances. Sadly, the phone might go and we could find ourselves invited into a withdrawal of treatment in ITU, which naturally is traumatic. And as we're engaging in these things on a daily basis, we naturally have medium and long-term plans. So currently working with colleagues in the communications team to advertise our annual baby loss service in October. And to my horror, in the next couple of weeks, we're going to have to start thinking about Christmas.
It does come round fast.
Yeah, thank you, Rachel.
Does.
Yes, it does. Yes. Yes. So a full day, yes.
Sounds very, very varied and very busy, and obviously talking to a lot of people, both staff side of things, but also patients and families.
Absolutely. Yeah, a very broad role, and I suppose that gets us wondering and asking the question, Catherine, what do you find most challenging within that very broad role that you have as a chaplain in healthcare?
Well, it really didn't take me much time to know how to respond to this. the area I find personally most challenging is the work we do around pregnancy loss and baby death. That just makes no sense. It just should not happen. I think there's a very hidden element to it. I think I'm right in saying that 25% of pregnancies end spontaneously.
Yes, it's 1 in 4. It's a harrowing statistic to think that. It's really...
Harrowing's just the right word, Rachel. Yes, absolutely, yes. And this reminds me time and again, particularly as a Christian, I don't always understand how or why things happen as they do. And when we're invited into that space again to pray for the child and the parents, I think it's very important to recognise and to be truthful in our prayers. And I choose to continue to believe in the face of catastrophe that God does remain the God of love. And also keeping a perspective, intentionally keeping a perspective on things very important. When I was about 2 years into the work, I was sitting in Costa in Darlington one Saturday morning having coffee and toast, and I kind of came to, and I realised I was studying toddlers running around. So I kind of came to, and I realised that might look quite odd because I was sat on my own, but I realised I was looking at these children in a way to kind of reassure myself that actually most children do survive being born. But keeping a perspective. Yeah.
When I first joined the Trust, I'd only been here a couple of months, and it was still at the height of COVID, so it was 2021, and we were bringing the memorial services back because obviously we'd paused during COVID, and we weren't having people in to do them, so we were recording them, and I got to go to the Darlington service. And it was incredibly moving and emotional, and it was an honour to be able to share that with families. And I know that we've had feedback. I've had friends who've been in that position and have had wonderful support from your team and from Jenna Goat, our bereavement midwife. So the support there through the Trust is phenomenal at a time when you are most vulnerable. Yes. So thank you very much for your team for everything that they do, and it's an honour from my perspective to be able to support the promotion of those really important services that we remember those lives lost way too soon. So thank you for that. So we've touched on some of the challenges. So how do you and the team, Catherine, deal with difficult or challenging times or circumstances, and are you able to provide counsel for one another?
Well, as I said a moment or two, I really am richly blessed at the moment to be part of such a wonderful team. And one of our strengths is that we're a group of diverse people, so we certainly don't all think the same. However, we do have this common goal that unites us, which is patient care, supporting and the staff, the chaplaincy role. But I'm part of a team where we really do seem to practice kindness and compassion on a daily basis. Our office often functions as our safe space in which we go to debrief. I think often it's a good thing people can't hear what's said in the chaplaincy office. We all need safe spaces.
Absolutely.
And I think also what's good for me is I do know I personally have a tendency sometimes to overthink. So it's good for me, colleagues, when sometimes colleagues poke fun at me and laugh at me. That's good for me because I can't take myself very seriously. So as I say, we certainly don't always agree over matters, but we do seem to be able to treat each other with courtesy and respect, which is very, very important.
Whenever we've, Alex and I, whenever we've popped in to see you, whether we've been asking you to do something or we've popped in for some advice or a listening ear, the kettle's on, you've got a huge variety of beverages on choice for people to be able to have, and very biscuits, which is always good. But it's good to know that there is that quiet space to go, and if you want to talk to somebody, there is somebody there, or if you want to say a prayer, is fantastic to be able to have that. And the chapel in Darlington in particular is such a wonderful space. I know I've found myself wandering along there quite a few times.
Right.
Absolutely, and I'll second that. The team dynamic is fantastic, and the work that we've done with your team has been a real privilege to kind of be in there and kind of engage with the team and be part of that dynamic. So it's really good. So the role itself, Catherine, as you've described it, it's kind of full of highs and lows in terms of those sort of challenges and those very rewarding circumstances. If we had anyone listening today who was thinking about becoming a healthcare chaplain, how would you sort of talk them through those highs and lows and how that kind of how that kind of impacts on you personally, I suppose.
Future chaplains, very important. Some of the very valuable work we do is helping to supervise people who are starting out in ministry and perhaps want to become chaplains. That's a real joy. I would say, on the whole, just do it. Don't hesitate, just do it. And I would have, I think, 2 pieces of advice. The first would be, it's very easy to say, but would be to look after yourself. So we would do that through 6 weekly clinical supervision. For those of us that are religious, I go for 6 weekly spiritual direction. And then also be prepared to see the best of people and also the worst and people at their most vulnerable, and not to underestimate the impact of the work on yourself. I think you were hinting at that, Alex. But yes, absolutely, go for it.
Fantastic, thank you so much. So we've really kind of focused massively on how you and your team can offer support for patients and their families and their carers. How do our trust chaplains support our own staff during stressful or traumatic situations? You touched on, for example, withdrawals in ITU and how that can be a terribly traumatic experience. But if we think about other areas in the hospital, this could be our mortuary staff, who are obviously dealing with end of life and everything that comes with that, and families come in for viewings and things like that. But then you're also dealing with maternity, high risk, dealing with looking after women and birthing people and babies and families and the stress that comes with that. But then you're also thinking about the day-to-day on the ward. So you might have patients who are suffering from delirium or from Alzheimer's, and that can come with a whole host of challenges. And then we know what's often depicted in TV dramas is the emergency departments and people getting frustrated with having to wait. So it can be a challenging role, whether you're a nurse, a doctor, a healthcare assistant, a domestic, whether you're working in the kitchens. It can be a stressful job working for the NHS. So how do you and your team support our staff then during these stressful times?
Well, again, Rachel, this is part of the privilege of the role, because, as you've said, we can go anywhere across the trust. 1 minute we can be chatting with the porter, the next minute we might be chatting with the chief exec or the chairman of the trust. We kind of reach the part perhaps others don't reach, but we do have this privilege. So, to answer your question, staff support, I think what I hope people, staff, colleagues value is the fact that the support can be quite informal. It's very much in the moment and almost on the hoof. And I hope that we offer a safe space to colleagues. I think we all need to know sometimes we can tell somebody something and know it will go no further. And sometimes, yes, indeed, naturally, as we might expect, ward staff, I can think of a particularly sad event recently around someone who was dying. Indeed, because we're human, sometimes a particular patient will kind of get under our radar. And I think, again, it's important to normalise that and to reassure people, yes, that's normal. That's how you're going to feel some days. So, informal and a safe space.
Fantastic, thank you very much.
And I would say from a workforce experience perspective, our team very much values that work that the chaplaincy service does. Obviously we as a trust, we try to support our staff as much as we can. We have various different ways that we do that, but I think it's very much been acknowledged recently, the work that chaplaincy has been doing and continues to do around staff support, and I think it makes a big difference and a big impact. And as you say, Catherine, you can be there at that particular moment in time, whereas it's more difficult for more corporate stuff like myself, where we're looking at quite a wide scope, to kind of be there in the moment for stuff. So I think that support's really invaluable.
And sometimes it just is, for instance, if you were in ITU and you were going through that situation, it's just a touch to the elbow and, are you okay? Do you need a break? You're there in that moment just to offer that and for that staff member to feel seen and feel that it's okay to, feel those feelings.
Well, it's very interesting you say that, Rachel, because last week a member of the ITU staff actually said that to me.
Oh, wow.
And you are so right. That touched me very much, that member of staff appreciated that perhaps it might be taking a toll on me as well. So
Mm.
it's about mutual respect and care.
Absolutely.
Yeah.
Thank you. So, Catherine, what is a common misconception that people may have about chaplains working in the healthcare setting?
Well, to be honest, I found this very, very difficult because I'm not quite sure how people perceive us. So I chatted it round with a few colleagues, and I do think a common misperception continues to be the fact that we're here for religious people only. Now, yeah, we are, indeed we are here for religious people, but we really are delighted to engage with anybody who'd like to speak with us. We don't judge people at all. People are people, and we're interested in the common humanity and how we can help if we can. I think that's the common misperception. I think also people might anticipate us being a bit straight-laced, maybe a bit prim and proper. And of course the real tough one is still, sadly, we go to a bedside, you can almost see the fear in people's eyes because they seem to think, oh no, the chaplain's turned up, am I going to die? Now, to be fair, they may be about to die, but they may not.
Yes.
So I wish we could break into those. And also I learnt recently some people perhaps have yet to understand quite what we can offer staff. So maybe that's something we need to look at. Yeah.
We can do that together, though.
I suppose that follows into my next question. I was going to ask is how patients and families can can make the most of the chaplaincy service. But you really sort of answered that question, because I think that it's very much about understanding the role of the chaplaincy service, what the services are, and the fact that it isn't just there for that religious support that we've talked about, that faith support, and I suppose all those kind of practices that go alongside that. You are there for everyone, staff included, as we've touched on as well.
Absolutely.
So I think that's a really important thing to take away from this.
Absolutely. And we also have our non-faith chaplain as well.
Oh, indeed, that's right. Yes, Jane's been a part of the team nearly 4 years now, so a very gifted woman and in a pioneering role. Absolutely.
And that just goes to strengthen what you've just said there. It's not just about people who do have faith or maybe lapsed faith. It's a service that's available for absolutely everyone.
I think we do genuinely have something for everyone.
So, Catherine, we've touched a little bit on COVID times and things being different. How would you say your roles evolved, especially with modern healthcare challenges like the COVID pandemic or high stress situations?
I'm not sure the chaplaincy process has altered that much. It's fundamentally quite simple. What has changed, almost out of all recognition, is the complexity now of people's needs when they present in hospital. Sadly, in the team in the last 2 to 3 months, we've noticed a surge in the number of people who are struggling with alcohol dependence, which I do wonder is perhaps a medium-term consequence of COVID. When I dealt with the pandemic at the time through my clinical supervision and spiritual direction, I try not to revisit it, if I'm honest. What I do remember is that at the outset I read an article in the British Psychological Society's journal about leadership in a pandemic, and to paraphrase, be present, be approachable, be available. And I think in essence that is chaplaincy. So again, we continue to adapt to the needs that are presented to us. The role has definitely become more demanding since COVID. Yes.
Thank you so much for sharing that and those reflections.
Thanks, Catherine, and thank you for sharing a lot of your experience today with us and kind of going over those roles of chaplaincy. As we've said, you do some fantastic work. Just to kind of wrap up then, what would be the best way for any staff members or patients that might be listening to this? What's the best way for them to get in touch with the service?
Well, we love it when people come up and say hello. You might knock on the chaplaincy door. The kettle probably will be on. We do provide various information leaflets which should be on the wards, but I hope we're daily a visible presence on the wards, so that's where you're most likely to find us.
Absolutely. And if I nip down to Holly's, I often see you having lunch or passing you on the stairs, or if I'm walking around the corridors, I usually see somebody from the chaplaincy team. Right. Usually having a smile or a chat with somebody as you're walking on by. So a huge thank you to you both for your time today. What a fantastic chat. I think we've covered so much in that short space of time. Thank you so much for listening to Inside CDDFT. I'm sure we'll be back very soon with another episode. Thank you very much, everyone.
This is Inside CDDFT, the podcast for the County Durham and Darlington NHS Foundation Trust.